Hey everyone, Luke here with the Knee Replacement Therapist. In this episode of the Knee to Know Show, we're going to talk about why strengthening exercise after knee replacement surgery is so important. Before I jump into that, be sure to hit that subscribe button, turn on the notifications so you can catch all of our videos related to knee replacement surgery. So, there's a lot of reasons why strengthening is extremely important and also extremely beneficial after having surgery. And it's beneficial in the short term, in the acute phase, but it's also going to be important and beneficial for the longevity of your knee replacement and the overall long-term prognosis. So when you have your knee replacement, in the vast majority of cases, there are certain surgeries that are a little different nowadays, but in the vast majority of surgeries, you're actually going to lose some of the ligaments within your knee joint. And that would be the cruciate ligaments, or what also means cross, and that's your ACL and your PCL ligaments that kind of go right in the middle of your knee and help provide stability for your knee joint, help reduce rotation, help reduce translation forward or backward of the bones that make up your knee. And so when you have a joint, any joint of your body, the tissues and the structures that provide stability to the joint are your passive structures, we call them, so things like your ligaments, your bone itself, and then there's the active structures, which is your muscles. And so when the passive structures are removed, or at least some of the passive structures, some of the ligaments are removed, that means that there's going to be some increased instability of the knee joint compared to a regular knee that has all the ligaments in place. So what that means is we have to add on top of that, we have to have further amounts of strength in and around the knee joint and the muscles that surround the knee to help provide stability to that knee joint with activities and stability to the prosthetic itself. And so the muscles I'm talking about are your quadricep muscles, so those big four muscles of your thigh. We're talking about your hamstrings in the back of your thigh, your calf muscles, and some other little muscles in and around the knee. And we want to make those muscles as strong as possible. Now, something in the acute phase after surgery is you actually have a lot of weakness. You have atrophy and decreased force production coming from those muscles. So we have muscles that we want to be really strong for a lot of important reasons, and on top of that, they're extra weak right after surgery. And I have some videos talking about why that's the case, but so the idea is that strengthening is going to be really, really important. One, to get your strength just back up to pre-surgical levels, but then to get your strength in your muscles even beyond that level to provide strength and stability to the entire knee joint, especially with functional activities, walking, hiking, cycling, exercises, whatever it is that you like to do. Something also to keep in mind is that when you exercise, you are putting stresses and strains through your bones and your skeletal system. And what this does is, especially with exercises that have resistance or weight-bearing exercises, is it helps maintain good bone mineral density. So you probably hear a lot about osteoporosis or osteopenia, especially if you're someone who's a little bit older or a female age, you're a little bit more prone to that. And when you have low bone mineral density or poor bone mineral density, your bones are very porous, your bones are very frail, that actually causes there to be less stability of the prosthetic, less of a comfort, and less of a good fit, which increases your risk of loosening of the prosthetic or failure of the prosthetic, or even possibly your risk of fractures to the bones. And so the more that you can incorporate weight-bearing, strengthening type exercises, not only is it important for your muscles and building strength of your muscles to provide that stability, it also is going to help you maintain good bone mineral density, good, thick, dense bones. They're going to allow that prosthetic to fit nice and snugly on the bone and have less risk of loosening of that prosthetic and increased longevity. So how do we do that? Well, we focus on a principle, it's called the SAID principle, S-A-I-D, and that's specific adaptations to implied demands. And what that means is when you are doing exercises, strengthening exercises, the muscles, the bones, the soft tissues, they're going to adapt based on the stresses that are applied to it. So I always talk about finding that happy medium where we're stressing the system enough to build up strength, to build up bone mineral density, and of course not too much where we're causing a flare-up and we're going beyond the level that you can tolerate. And of course we want to focus on weight-bearing exercises are tremendously beneficial, especially for bone mineral density. Things like squats, deadlifts, step-ups, lunges, and plenty of other things. Exercises that focus on multiple body parts, multiple joints, your hips, your knees, your ankles. Everything is working to perform the exercise, and you're building strength in multiple areas. I hope you found this video insightful. Please, of course, leave your questions and comments below. Hit that like button to help spread it out to other viewers. And again, if you don't subscribe already, I'd appreciate it if you hit that subscribe button and turn on the notifications, and then you won't miss any of our latest videos. Thank you for watching.